Leprosy is one of the oldest known diseases and continues to be a challenge despite a substantial fall in its prevalence in the last few decades. Millions of people over the ages have suffered in silence, assuming it was a curse from the gods. People affected by leprosy were either abandoned or forced to live in exclusion in leprosy colonies. Untreated painless patches lead to large ulcerations, loss of digits, skin nodules, eye damage or facial disfigurement.
எனக்கு வந்து முதல்ல தேமல் இருந்த மாதிரி இருந்தது. அவன் காலெல்லாம் வந்து எக்ஸமா மாதிரி வந்துச்சு.
If left untreated, the disease will continue to disfigure and disable. Norwegian scientist Dr. Hansen in 1873 discovered that leprosy is caused by Mycobacterium leprae. The cure came only in 1955. Every year, 127,000 new cases of leprosy are detected in India and 4,000 of these cases are disabled. These disabilities are lifelong.
Because of the involvement of the nerve, loss of sensation will be there in the limbs, that is the hands and feet. Weakness of the muscles will be there. People develop clawing of the fingers of both hand and feet, and foot drop, leg ophthalmosis, etc. because of the involvement of the particular nerves.
Leprosy is curable. Medication in leprosy is called MDT, multi-drug therapy. These people require special care and services because of the painless nature of the disease. With a vision to treat and care for people affected with leprosy, GLRA India was established in the year 1966. Mr. William Gershon and Mr. Herman Kober, dedicated social workers and men of substance, were crucial in the growth of GLRA India. Till date, GLRA India has covered a population of 47 million and bestowed 2.1 million lives. GLRA has 3 regional offices in India and networks through 51 partners in 14 states and 1 union territory. GLRA India has 35 centers with diagnostic and treatment facilities. 19 centers have footwear care and production facility. Prompt treatment can prevent onset of disability and deformity in leprosy. Once disability occurs, the patients are given special footwear called MCR to support them in walking, eyeglasses to protect their eye and provide better vision, calipers, walkers, wheelchairs to help patients become mobile and encourage them to lead a normal life. Reconstructive surgery is a boon to leprosy patients. Through surgery, the deformed limbs can be corrected to a very great extent. 200 surgical procedures every year. 7 centers have surgery facility. Ulcer care and septic care are important aspects of leprosy care in addition to handling disabilities and surgical correction. About 12,000 patients are trained in self-care methods in ulcer care.
Rehabilitation is nothing but providing an alternative job which they can carry out without injuring their hands and fingers and their feet.
This helps the patient to be reintegrated into society, live with dignity, and have equal access to opportunity.
The main objective of rehabilitation is to restore the dignity of the individual who has been affected by this disease, because he is kind of shunned by the society, and he has to, in order to take his treatment, he loses his wages, and the disease affects his social status and he is getting into a level of poverty. So in order to bring him out of this, not only from the social and poverty level, but also to boost up his image in the society, rehabilitation plays a very crucial role.
2,499 persons received housing loans.
சொந்தக்காரெல்லாம் யாருமே பார்க்கல. தோணும் என்னும் போது எனக்கு வாடகை கூட வீடு விடலை. தெரியுதுங்களா? இந்த வீடு விடாத போயிடுவேன். இங்கே போய் நாங்கள் போய் முறையிட்டோம். அப்போது இருந்து சிஸ்டர் பிரிஜிட்ன்றவங்க எங்கள் மேலே கருணை வைத்து அவங்க இங்கே வீடு கட்டி கொடுத்தாங்க. அவங்க ஆதரவு கொடுத்து இங்கே வீடு கட்டி கொடுத்து இங்கே வந்து போட சொல்லி எங்களுக்கு லோன் கொடுத்து எங்களுக்கு பட்டு தண்ணியை வச்சு லோன் கொடுத்து அரிசி கொடுத்து எங்களுக்கெல்லாம் வாழ வச்சுன்னு இருக்கிறாங்க. 22 வருஷமாக இந்த வீட்டில் இருக்கிறோம் நாங்கள். இவங்க இல்லைன்னா நாங்கள் இல்லை.
36,096 children received educational assistance. 3,683 persons have received job placements.
General India is quite proud that in the last almost 50 years, we have done a significant contribution in terms of curing people affected by leprosy and tuberculosis. But in the last few years, the support that was available in the past for this purpose has come down drastically. The reason is, in 2005, Government of India declared officially the elimination of leprosy. But the word elimination is more a technical word, which means the rate of new or prevalence of leprosy has gone below a particular limit. But it doesn't mean leprosy is totally over. Even till 2011, we have identified almost 135,000 new leprosy cases in India. So that's the caseload and the workload is still there. So for this purpose, we are trying to contact philanthropists, local individual donors, corporates, and every money contributed by them will help for this cause in a great way.
The challenges in control and elimination of leprosy in India are many. Times have changed, and so is the profile of the disease now. Sustaining what has been achieved so far and further reducing the disease burden in India requires an innovative, holistic approach that includes intensifying education, methods to detect cases early, interventions to dispel stigma, and to introduce community-based rehabilitation to those under care after cure. The journey of 1,000 leagues begins with a step. Extend your support and help us build better societies.